Hello, everyone. Thank you for attending our webinar this evening. We're just going to wait as the names pour in. I see some attendees popping in the Zoom. Anyone who is attending, feel free to share your location in the chat. Let us know where you're at. Let us know maybe if you're a healthcare professional so we know who's here. Do we have doctors? Do we have nurses? Do we have social workers? Do we have pharmacists? Do we have people from the public who do other things? Let us know who you are and why you're here and where you're at. Resume recording. We have people from Toronto, people from Victoria, Costa Rica. Oh, that's nice. Oncologists from San Francisco. So many places. Surrey, Vancouver, Montreal, Nova Scotia. Social workers. Death doulas. So also feel free if anyone has any questions for us. We're going to save some time at the end. So throw your questions into the Q&A section of the Zoom, and we'll try to get to your questions at the end after our discussion. And so this is our webinar on psilocybin therapy for palliative care. I'm Natasha. I am the clinical intake director at TheraPsil, and I'll be hosting this webinar, bringing us through. I have Yaz with us. She is our director of training and operations. She'll be answering some questions in the chat, possibly putting up some links for us and helping me navigate hosting this webinar. And we have Dr. Alexis Goth and Dr. Fraser Black, and I'll let them introduce themselves after a little bit of housekeeping. I'll start off with a land acknowledgement. So when I am in Victoria working, I am on the land of the unceded territory of the traditional Lekwungen peoples. Currently, though, I am in northeastern Ontario, which is the ancestral land of the Anishinaabe and Cree peoples. I recognize that the work TheraPsil does with psilocybin is in the Western medical context, but the whole field of psychedelic medicines wouldn't exist without the Indigenous knowledge keepers and the use of psilocybin mushrooms throughout centuries, used as a sacrament within Indigenous cultures. So I really want to acknowledge that and where that comes from. A little bit of an update on TheraPsil and where we're at. We have a total of 41 Section 56 exemptions that have been granted, 36 of those being people who have an active diagnosis or are palliative, and 5 of those being people who were in remission. And we continue to support patients who have end-of-life diagnoses, and we also have supported a small pool of people with other diagnoses, such as cluster headaches, anxiety and depression, PTSD, substance use disorder, because we do believe that everyone should have access to this medicine, and we want Health Canada to understand that. We're really excited that our new health minister, Jean-Yves Duclos, he has approved 2 exemptions since he's been appointed. And so that is definitely encouraging from our end. We continue to advocate for exemptions through our media campaigns, such as these webinars and things that we conduct. And we've just released an open letter from many different healthcare practitioners who have signed the open letter and released that openly to the Minister of Health about how psilocybin regulations should be created. And we're also moving forward with our court proceedings with Health Canada, pushing for current Section 56 exemptions to be granted and for psilocybin regulations to be created. Another exciting thing I would just like everyone to know is tomorrow we are going to be releasing some information about our newly launched collaborative research study that will be happening with Imperial College London, McGill, and Northern Ontario School of Medicine. And all patients who are granted Section 56 exemptions moving forward will have an opportunity to take part in that research if they'd like to. We also will be launching our second in-person training in the next 2 weeks. And if anybody on this call is interested in training, I encourage you to go to our website and go to the training page to sign up to be on our wait list. And anyone who wants to advocate as well can go to our website to the Take Action page or the home page to see ways that they can help us to advocate for psilocybin regulations. That's it for a little update on what's happening on our end. And I'll just let everyone know that I'm a registered nurse. I'm the clinical intake director at TheraPsil. And before I did this position, I have a background in geriatrics and palliative care. And so really, I'm very blessed that I got to take that experience. And now I get to do this job and help patients, many of them palliative, gain access to psilocybin therapy. I would love to now allow our panelists to introduce themselves. They are both physicians. They're both very knowledgeable and have an expertise in their field. And I just want to acknowledge that physicians are so important in this work because they carry the responsibility of signing off that this is safe for people and prescribing, hopefully, once psilocybin regulations are created, and supporting these applications. And so we couldn't do this without physicians like yourselves. So I'll give it off to Alexis to introduce herself first.
Hey, thanks so much, Natasha. Excuse me. So my name is Alexis Goth. I'm a physician in Halifax, Nova Scotia, in Canada. I'd also like to acknowledge with honor that I am on the unceded land of the territory of the Mi'kmaq Nation. And just introduce myself. I have 3 children. I was originally trained as a family physician at Dalhousie University, and then went up to Northern Ontario practicing really remote general medicine that involved primary care, hospital medicine, and emergency medicine. And not surprisingly, after 6 years, I went through my own burnout and health crisis and became really interested in integrative medicine and really wanting to adopt a genuine holistic viewpoint to approach healing. I went and did a 2-year fellowship in Arizona under Dr. Andrew Weil, and then continued in functional medicine training. Came back to Nova Scotia, where I practice still as a hospitalist in a tertiary care hospital. And we do general adult medicine, all systems, mostly geriatric populations with a lot of palliative care. And I've become really interested in pulling in, and because of that holistic viewpoint, a much more expanded view of wellness, including consciousness. And of course, a natural entry point would be through psychedelic therapy. So I'm doing the TheraPsil training program now in the Atlantic provinces with the goal to pull psilocybin therapy into my work.
Thanks, Alexis. Fraser,
Well,
let
thanks
us
so much.
know.
Yeah, thanks, Natasha, so much. And again, thank you for this opportunity. It's just so great to come together today. And actually, Alexis and I had a chance just to chat briefly today, and we're excited about the new connection for us. So my name's Fraser Black, and like Alexis, my background is in family medicine. And like many family physicians, we're fortunate that we can kind of dip into different areas that are of interest and we feel are important. And so, you know, certainly as a family physician, a lot of my work has been done in the inner city, but probably even a larger amount has been done in the area of palliative care. I have enough gray in my beard to say that I've been doing it for a while, both with adults and with children. I also teach in a group medical visit setting, mindfulness for people who have pain, anxiety, who are facing end-of-life issues, and some that have PTSD. And so I think I've always kind of been looking for other things that can help people who are facing distress. Mindfulness was something, as I said, that I've been dipping my toe into and providing to patients, and the very exciting opportunity to expand that then in terms of psychedelic medicine for especially the patients who are facing end of life. But I also have look forward to a time that we'll be able to offer this to so many other people as well, and some of those being my patients and people living in the inner city. Natasha already mentioned that that she comes from the unceded territories of the Lekwungen people. I do as well, and that's where I am today. And so again, thank you so much, and look forward to our session today.
So to start off, I would love to just touch on these patients that we're hoping to support with psilocybin. They're facing end-of-life related distress. And with your work with these people, how do you see that distress presenting? What are the symptoms that they're facing that we're hoping to resolve with psilocybin therapy?
Sure. The patients that I'm encountering are in the hospital setting. So usually in the course of their illness, I'm seeing them quite late, and they can be having very physical symptoms of obviously of pain, shortness of breath, insomnia, but fear obviously being a really common shared experience in almost all patients, and vulnerability, deep vulnerability in the hospital situation. It's such a vulnerable place to be. So there's obviously that, just I guess the uncertainty of what it will look like, the potentially unresolved conflicts in family, unspoken issues that may have not been resolved, and seeking connection. I think they're really trying to seek connection at end of life that they may not have been able to seek up until that time.
Well, Alexis, I think you covered that so well. But yeah, I think in palliative care and in so many areas of practice, I think not only are we dealing with the physical issues, pain, shortness of breath, nausea, vomiting, but some of the other issues that pertain more to meaning and pertain to who am I and what's happening, and so often in palliative care we talk about total pain, and that suffering isn't just physical, that there can be so much more, and that for some people getting lost in that picture of kind of total pain, existential distress. And we have some approaches for that, but it's very challenging. And then that sort of creates suffering around for the families and the friends that are journeying with these people too. So.
And what are those other treatments? Like, what are the options now for people at end of life who are dealing with this distress? How can we help them without the psilocybin therapy?
Yeah, and again, great for Alexis to jump in too, but I think just simple presence goes a long way. That listening ear, that gentle touch, that recognizing that we don't have all the answers, especially as it comes to living and dying, but not being afraid to journey with people. So I think that is actually really powerful medicine, just to be there and be available not only to patients but to families and friends. And then of course we have our other pharmacologic therapies, which have limited value, and for people facing end of life, sometimes those medications can take a longer period of time to work. Again, we have lots of very skilled colleagues in palliative care. We work as a team, and so to have our counselors, to have our social workers, to have our therapists, to have people who have mindfulness practice, all those things are also so helpful for helping support patients and families. And I know that we're going to be talking in a little bit more about sort of palliative sedation and things like that. So I won't talk about that yet, because I think we'll talk more about that. But Alexis, I've probably forgotten some important points there in that.
Not at all, not at all. You did amazing. I love that reminder, because it seems so simple, and yet it is that. It's simply sitting with a patient and witnessing and allowing them to express that which they're feeling without interjecting or trying to fix it or judge it or problem solve, because so much of medicine is problem solving, where there's deep experiences they're having. There's no direct solution. And I think allowing them to just be heard and mirror back to them, it's really challenging. It just really is hard. And hearing someone else recognize that it's really challenging. Yeah, and like you said, we also have a team where we do have a paucity, though, of people who are offering direct counseling in the hospital, which I always find really concerning. There is spiritual care, which is amazing, but there's just a handful of psychologists. So it does fall to nursing staff, the physician staff, and we're trying to do that when we can, but it is a deficit we have, I feel like.
Yeah, and I think that at end of life, really the person-centered care it's always important, but even more so of like what are their wishes and what do they need, and being open to whatever alternative therapy or alternative treatment or conversations or goals or whatever it is that that person is needing that they express, and just trying to help them to get there, right?
And then just jump in there and say, yeah, I mean, that often people themselves know best what they might need. And so trusting that when we hear, people talking about the things that they feel that are going to be most helpful for them, that are going to help them, achieve what we often call as their goals of care, and aligning, our therapies and aligning our support to help them, achieve those goals.
Yeah, what comes up for me is just the beauty in how the perspective of those who work in palliative care and hospice aligns with the perspective of those who understand psychedelic assisted psychotherapy, around it being patient-centered and being patient-focused. And it's a really nice combination when you join the two. And we at TheraPsil, we have a specific clinical protocol that we follow that's based on Johns Hopkins, UCLA, NYU research, in which we have, prep, treatment, and integration. I'm wondering if either one of you have had an opportunity to see patients experience psilocybin therapy in this context yet. And if you haven't, what do you hope that they would get out of the therapy if your patients did have access to it?
I'm
Not.
pausing, Alexis, to see if you'll go first.
I was gonna say, unfortunately, I've not had it would be the deep pleasure to work with a patient that's had this type of therapy, how it's been outlined by yourself and Johns Hopkins. Our hope is with the training, we'll be able to be offering it. So I've not been able to follow or know someone that through that experience, but I would certainly, really hope that, especially because their preparation, that they would have that that union and that trust and that deep compassion and sense of security with the clinician they're working with, and then the experience of themselves, that first person experience that can be so much more expansive than maybe their prior experience with self or reality, where they can really come in contact with intimate love, with infinite love, with love of self, love of other, and a capacity for forgiveness that can be incredibly transcendent. And then, of course, the time to integrate and pull meaning into that experience and from that experience, so they can hold it in their narrative and in their personal journey, so it's meaningful for them.
So maybe disappointing, but I too have not yet had the opportunity to be with somebody using, who's been able to access through the exemption. And that's frustrating because, again, having just completed the in-person training and believing that this is going to be helpful to people, I haven't. That being said, we have been fortunate, as Natasha mentioned, to get some exemptions. So there are people in sort of the Vancouver Island area that have received it. And so some of my colleagues, other palliative care colleagues, have been able to talk about their direct experience. And excitingly, our medical community here, palliative care community, we've been able to talk about it in rounds and things like that, and do some case discussions. So yeah, I think we're excited to also be able to have that direct experience for people, supporting people.
Yeah, with only 41 exemptions so far and them spread across Canada, there aren't that many opportunities yet to take part in this work. And I'm very blessed to have held space for someone who was palliative and had a Section 56 exemption, and it was a transformative experience for that patient. They, in their own right, were very prepared for the journey. They did a lot of inner work and they were very grounded in their intention. And I think that was part of the reason why it was so transformative for that individual, which was very beautiful to witness. And also through the connection with patients that I'm helping, I get to hear so many stories from people. I just had an email from a patient last week that he expressed that throughout the whole time I was helping him apply for his exemption, that he couldn't leave his house. All he was doing was watching Netflix. He was scared all the time. And he just sent me an email saying that he's went to Canada's Wonderland with his family and rode every ride. and he reached out to people he hadn't spoke to in a really long time, and that he no longer has the fear and anxiety that he has. And he also expressed that he was hesitant to do it in this context with sitters in the clinical protocol. And I'm not sure why, but he was hesitant, but he did. And he expressed to me how he now sees how impactful that was and how important it was for him to have people with him to be supported in the way he was. And so, yeah, those stories just really fuel me to move forward with this work. Referring to your work in palliative care, I know that both of you have experienced supporting people accessing MAID as they make their way through their end of life diagnosis, and it feels like the right decision for them. Do you find that these people are aware of psilocybin therapy as they're pursuing this, or do you think they should be educated about psilocybin therapy?
I'm happy to go first, and I would just say, you know, even before MAID legislation was being considered, some people have long been asking for hastened death. And so those have been conversations that I've been having, with some gray in my beard for decades. And it was a conversation that, you know, was not always easy, because there weren't, you know, the options that people were hoping for, but still meaningful conversations. I think, you know, more recently with MAID being available, and then with the changes to the legislation, and just sort of it being so widely known, on Vancouver Island, we have actually a very high number of people compared even to other jurisdictions in Canada and around the world. And so there definitely is great knowledge about this as an option. Similar in kind of the chronology of things, beginning to have people talk about, you know, access to psilocybin or to other medicines. But most people talking about, asking for, wondering about, wanting to have something like MAID in their back pocket, just in case, are not really aware of the possible opportunities for psychedelic assisted therapy. Some are, like I was saying to Alexis earlier on the phone, we did have a patient recently who was specifically asking for that as part of a discussion around MAID. So.
Yeah, I would totally echo that as well, Fraser. I've definitely had, because the work I also was doing before was on complex chronic stress and complex chronic disease. So I would have clients in that arena ask me more about psychedelic and psilocybin therapy. But perhaps because the patients I see in the hospital tend to be older, they're more geriatric. I've not had someone ask. I don't get the impression that they or their family have an awareness about it. And prior to recently, I didn't feel comfortable maybe offering it because we didn't have the structure to support it. But I don't think there's a high awareness, at least in the people that I'm seeing.
Yeah, and it comes down to, at this point, we're in this little bit of a gray area where it's not yet legal or regulated. And so it's like, do you bring it up or do you not? Because you don't want to impose your views on someone. You kind of want them to bring it up themselves. Just like my experience working as a nurse with MAID, I would never bring up MAID unless somebody indicated to me that that was something they may be pursuing. And I feel like maybe it's the same way at this point with psilocybin therapy. But I imagine that if psilocybin did become regulated and was available, that it probably should be in the conversations that physicians are having with patients around their options before pursuing MAID, that maybe they do have an option of pursuing this therapy, for sure.
Yeah, I think depending a little bit on what other reasons that the person is wanting to pursue MAID. And I think some are going to align quite closely with, you know, psychedelic medicines and psilocybin specifically, being able to support them with the thing that they're struggling with. And just like any therapy, though, it's not going to be for everyone. But I think it, you know, it's something that's is definitely for people, going to be something that just adds that opportunity for some, you know, healing. Really, we talk about the fact that people that are are dying, it means that they're alive, and that in that living as they near their death, incredible things can happen in terms of healing.
Yeah, what comes up for me as we talk about this is just getting more physicians widely educated about what might indicate the need for psilocybin therapy or a benefit. So when they're having those conversations about MAID, they also have in their mind whether this person may be an appropriate person for psilocybin therapy, or maybe they may benefit from it. So they know that as they're deciding whether it's something to bring up or not. More physicians need to be aware of what this entails and how it can help people. Do you think that potentially we may end up having psilocybin therapy covered in the palliative care benefits program?
So that's in BC. We have a palliative care benefits program, and I'm so thankful for the people who work on that formula. But to be honest, I struggle getting some antiemetics covered, some anti-nausea medications. So wouldn't it be great? And I think we can do some advocacy around there. And again, I think, that there can be ways that we might be able to support people. But to be honest, I think it would be a while before we were actually able to put it in that bundle of things that might be palliative care benefits. Not to say that it isn't going to be a benefit for people who are receiving palliative care, but that will be another level of advocacy. And unless there's somebody in the audience who works on the palliative care formulary and can tell me differently.
I wonder, Fraser, if any counseling in general is covered under the palliative care benefits program?
So not specifically under the program, but certainly within, the services that are available through, different health authorities. And again, we're going to have differences across Canada and across the world, but absolutely there are counseling and supportive therapies that are covered, not necessarily just under something that in BC we call the palliative care benefits program. So, again, I hope that we can find ways to make it accessible to people, and that money is not going to be an issue or a barrier.
And so going back to, oh, sorry, Alexis, did you have something?
Nothing. I was just going to add, I don't think we have a similar program, but I'm always really hopeful and optimistic about philanthropy and conscious investors and people who may hear of these programs, and there may be a private or a funding that's coming from outside the public system where a lot of advance and change can usually come from.
For sure. And it's all we have to do is put it out there into the universe, and someone will hear it and they'll come and help us, and right. And so I just wanted to bring it back to MAID for a moment. In February of 2021, senators voted to give the federal government 18 months to expand the medical assistance in dying to people suffering solely from mental illness. And I'm wondering that if in August of 2022, they decide to open up the program to those suffering from mental illness, what does that mean for palliative care doctors that are currently providing MAID? And how might that play into psilocybin therapy and access to it?
Can I jump in first, Alexis, there, just sort of practicing? So, and Natasha, I appreciate the question, and it's interesting, but I think I just want to emphasize that not all palliative care physicians offer or provide MAID, and in fact, at least in our jurisdiction, it's actually, we've got quite a number of physicians that offer it. Most of them not being palliative care physicians. So as a palliative care physician, we're often having the discussion. We might be part of the assessment, but we may not be the providers per se. And so, I think I just want to make that clear. And I think that with the newer legislation, even with the newer legislation, which is the sort of not foreseeable death, I would just say that palliative care is probably less involved and certainly less comfortable in maybe doing those assessments leading to MAID, just because again, that's not a patient population that is palliative care physicians, like non-foreseeable death, that we would typically be working with. And again, not putting Alexis on the spot, but I think in the work that you do, and I think you're seeing a broader spectrum of people who may have foreseeable or not foreseeable death.
Yeah, I think that that's accurate. Our general hospital population, there's patients that come in not planning to enter a palliative state that do, that then are then engaging with palliation. But I guess I'm really curious when I heard that MAID was expanded for these mental health experiences, and if psilocybin is then available when MAID is offered, it may be a really interesting opportunity for folks that have been struggling with mental illness for a very long time, and they're refractory or not responding to, the current Western model of treatment. And it may be a mechanism by which they can then access psilocybin or psychedelic therapy that can be extremely transformative. And my hope would be that they would actually no longer wish to actually exact the MAID, but the entry into the MAID program may be an opportunity to access the therapy, especially for, as we know, PTSD, trauma, complex trauma, especially if MDMA follows suit, as we hope it does from as psilocybin is now. It may be a very, very interesting mechanism to offer this therapy.
Yeah, I was having a conversation with some friends recently just around someone who feels maybe suicidal or that they want to end their life, and that there's this stigma in society around that currently, in which they don't speak about it, and maybe they're feeling alone. Where if it became destigmatized, that you could just go and speak to your doctor, say you're 25 and you've been depressed for 10 years and you're just like, I want to end my life. You're able to have those conversations. So then maybe throughout those conversations, you feel empowered, you feel supported, you're connected, and you can be connected to resources. And it seems so much more healthy to be able to be open and to not feel as though you can't speak to a healthcare practitioner about how you're feeling, because you won't be able to legally end your life if you want to, or if you feel like you can. So I see definitely the potential of it being a pathway to better help for individuals if they can access the MAID program and at least start the process. And I also think that it's an amazing advocacy opportunity from TheraPsil's front of just broadening access to psilocybin therapy in general, right? Because we're always saying, if you have the right to die, then you should have the right to try. So if all individuals, even those suffering from mental health, have access to MAID, why shouldn't they have access to psilocybin therapy?
And Natasha, I'm going to jump on there and do another political advertisement to say, and access to palliative care, because there's still so many people across Canada that don't have access to palliative care. And then as we look to the rest of the world, so many, much more. And so, I think, access to palliative care, access to, psychedelic medicines, again, I think we have advocacy for in a lot of areas, especially as it relates to people sort of choosing MAID when they think that there aren't other options. So yeah, I couldn't help it, Natasha. Sorry, had to say.
I love that. Access really to all things that people need to make themselves better, right? Accessibility and equality for everyone, really. Yeah. And as physicians who are engaged with TheraPsil, are or have completed our training, what roles do you see yourselves playing in the psilocybin therapy, overseeing it in the treatment? How do you guys see yourself taking part?
Well, for myself, that was a good question, because I wasn't sure if I see myself doing the actual therapy itself, although I would love to explore that. But I think adding to the advocacy, vetting this medicine and exploring this medicine in a more public, open, honest dialogue, because it's been in the shadows for so long, and there's so much bias and a lot of misinformation about psychedelic therapy. So I'm really interested in adding that lens. I'm also really interested in the science of neuroplasticity and recognizing how we can optimize our cellular health, our mitochondrial health, and how maybe joining the psilocybin with an awareness on neuroplasticity can really optimize the experience and then help integrate it even further. So I'm really curious about it it's another really, really powerful tool in an integrative model, I feel like.
Yeah, I would absolutely echo what Alexis said there. And I think, I'm looking forward to, again, trying to as regulations change, but as maybe exemptions are processed more quickly, helping to, as a physician, to be a part of trying to get access to decrease barriers to patients to access this through an exemption or through, again, hopefully we'll have broader opportunities. So making sure that the medicine can be accessed in a safe way, and I really appreciate the way that TheraPsil's approach and clinical protocol and such. Again, there are people for whom we wouldn't want to necessarily offer this, or a situation with other medications that we need to be making some adjustments. So I'm interested and motivated to be a part of trying to make sure that we're decreasing the barriers to getting the medicine for individuals and for communities, populations. I'm also excited, like Alexis, for some of the advocacy, and I think as sort of working as a physician, I just want physicians and other health professionals to remain curious. And so I think I'm looking forward to hopefully trying to increase the curiosity, increase the comfort in just having the conversation. And so we're doing surveys now around attitudes towards, psychedelic assisted psychotherapy for people facing end of life, where, as I said, talking about it in some of our case presentations. And so I look forward to continuing to do that. And then, I actually, hope to be part of helping someone along in the TheraPsil model in terms of sitting with someone who is facing end of life, but has chosen to use the psychedelic medicine and being part of that. So I look forward to that opportunity as well.
When it comes to TheraPsil's clinical intake protocol that I bring patients through, I pull in physicians to do the final sign off of the patient being safe, right? To assess the inclusion and exclusion criteria. And then I ensure that each patient has a primary physician who can be there to consult with the therapy team, to advise on many medication changes. And my goal right now is to build a system on our website to make it really clear and simple for community physicians to engage in that process, potentially to create referrals to TheraPsil trained physicians if needed, or to educate themselves about these inclusion and exclusion criteria and how to oversee treatment so that we can have more physicians be able to support more patients. And hopefully be able to build pools of physicians across Canada who can consult to other physicians so that they can educate each other, and have community physicians eventually be able to support their patients in accessing psilocybin therapy, eventually with the goal of it not even needing to be a Section 56 exemption, just a referral, a prescription per se, that then is referred to therapists. So physicians out there, keep your eye on TheraPsil. We'll be launching some educational in-services in the near future, probably early 2022, to get you guys informed about psychedelic therapy and how you can take part and support patients.
Natasha and Yasmin, I'm always so impressed at how you can just make things happen so quickly. I mean, we just talked about that like weeks or a little while ago, and to think that that's going to be coming out in early 2022. Thank you so much.
It's always exciting here at there, so we have a lot of fun.
I love that. I love the idea of simplifying it, because so many clinicians, they're so in primary care, they are so, in the depths right now. They're working so hard and they're just inundated in so many ways. So something that's so novel and so unknown to them, I think as much as that can be eased, the accessibility to that information as easy as possible would be really beneficial, I think.
Yeah, and my hope is to always give them the ability to connect with physicians who are experts in this, so that they can continuously bounce ideas, consult, and then that will be a way for them to inform themselves. And I think it will be a great model to connect people. And when it comes to physicians, prescribing psilocybin therapy and overseeing psilocybin treatment, What training do you think they require to be able to do that? Like we talked about in-services, and we talked about you guys being part of TheraPsil's training. From being physicians and your perspective on this, what do physicians need to take on those roles?
Do you want me to go ahead?
Sure.
Maybe that's my own neurosis or my own feeling that I really want to understand something fully. But personally, I would not feel qualified doing this until I had a formal training. And that may speak to just my personality. But I think a lot of physicians are similar. They want to feel really confident and proficient at what they're doing. And they also want to know that they're doing something really safely, and that based on their professionalism and their work, they want to know that they're doing it to the best of their ability. And there's a very high standard. So I personally am really for a formal training program, whatever that would look like, whether it's TheraPsil or something separate, but I think it's really important.
Yeah, I would agree absolutely, and I think that is so helpful because for all of us, but we don't want to do harm, and I think physicians, take oaths about doing no harm, and they worry because they just, don't necessarily know, and certainly wasn't something that was talked about when I went to medical school. So that fear of not knowing and maybe not having curiosity, but that fear of doing harm. And so, I think being able to help alleviate that harm, creating opportunities for, as I say, curiosity and questions. So I'm comforted by the fact that I'm, there's a group of physicians, actually, some that I knew before and some that I just met that have this interest and are doing the training. An oncologist that I'd worked with for years, and we showed up at the training together. It was like, oh my goodness, it's so great to see you here. We have an interest and something that really now together we can work together to support other physicians and other practitioners as well. So
yeah, something that Yaz and I are proposing is having 2 tiers of physician training, and like one is the intensive or the whole training where you can then sit for patients, versus an informative training in which allows you to oversee the treatment but not be the co-sitter or the sitter for the training. And I think that will be a good way to make it accessible so that physicians don't have to do the entire training to still oversee the treatment, but have the information and feel qualified to do that. So that's our hope for sure.
I just want to chime in there. Sorry.
No, you go ahead. Go ahead, Yaz.
Yeah, so I just want to chime in there. Something else we're looking at, because I know that some folks might be on the wait list for our training. We're also looking at doing a 2-day intensive, because the information right now is crucial, and informing folks on our wait list, even if they're not a medical practitioner, is amazing, because we need more voices behind TheraPsil to say to the government why this is so important. So we're looking in 2022 to also be rolling out a 2-day intensive training that doesn't allow you to per se guide psilocybin therapy, but informs you on the benefits. So that's something to look forward to as well.
So much to look forward to. That the thing that I wanted to add, and that I hope doesn't happen, is I hope that sort of the physician piece doesn't become a barrier to people getting therapies. And so often the system creates structures around physicians that then sometimes end up being barriers. So I hope, that we can continue to educate physicians and other practitioners, but also, be attentive to again, not trying to help dismantle barriers that would exist to accessing therapy.
So right now in our model, we would require that a prescriber, so it could be a physician, could be a nurse practitioner, would prescribe psilocybin therapy and be the final sign off. And yeah, a barrier may be accessibility to those physicians and patients having access to someone who could support them, or TheraPsil having enough physicians in our pool. And that's something we're really trying our best to navigate, how to increase the availability of physicians to do that. Do you guys have any thoughts around how to reduce that from being a barrier, or how to increase our pool of physicians available?
Yeah, I think just the things that you're doing, and I would also add, I think some of us are also, because this is newer ground, trying to be honest, to navigate it with our colleges And I think so, another area of advocacy is to make sure that, physicians don't want to do harm, and but they also don't want to be hurt. And so making sure that we're doing the work that's going to make physicians and nurse practitioners and others, feel comfortable that the system's going to support them supporting these therapies. So, I do think that's an area of work that we, can continue to do. And then to demystify that for other, practitioners, and that, as we move forward, so they don't feel like that they're doing something that isn't going to be supported by their colleagues or supported by their colleges or regulatory bodies.
Yeah, I really agree with that. At the college level, it's so important. And there, can be some harsh lines taken by the college that I think over time with more education can soften, but it can be very challenging at the college level for physicians. Also maybe buddying up some clinicians that are more comfortable prescribing with maybe newer clinicians in a kind of shepherding kind of relationship where they can gain some knowledge and some confidence with other clinicians.
And that pulls me to like, why do we need psilocybin regulations, right? These are all examples of that. And the current process that we're bringing end-of-life patients through, there's a lot of reasons why that process isn't ideal currently. So if we could touch on like, what would be better about providing this treatment if there were regulations? How would that help these end-of-life patients? How would it improve their experience?
Sorry, do you mean if the regulations are still in place, how does it improve the experience?
If we did have regulations enacted,
Right.
what would you see would improve for these end-of-life patients that we're supporting?
I'll add a couple things first, but I mean, I think one, hopefully it would reduce the wait time that people are waiting for exemptions, and the sort of all of that effort, which Natasha and others at TheraPsil, I'm so glad that you're able to support, because it's daunting, can be daunting for people. So, again, I think that that kind of thing would be helpful. Also, we haven't talked about it, but I think, access maybe to a medicine that is consistent and standard, and that we know what's essentially on this medicine spoon, right? So again, we haven't really talked about that, but wanting to make sure that people are able to access medicine that they know is a sort of standard dose and is the medicine, is another important piece of this, I think.
Yeah, I would agree. Like the wait time, when there's already so many stresses being experienced by the client or the patient, the idea of a linear wait time when they already know they have a terminal condition, I mean, that must be really, really adding to their entire stress experience. So if that is somehow shortened, eliminated, or if there's just a lot of hope that whatever the process, there will be a positive end result, it takes away that uncertainty. And certainly whether it's extended into mental health, that must again be a very significant stressor if there's a client that believes that they could really benefit from a medicine that they're just struggling clearly to access.
Yeah, we're seeing, unfortunately, that some people are dying before they get access to this after submitting applications, which is very disheartening. And that shouldn't be happening. Like, it would be nice if it was that physicians could do the assessments and then we could refer to therapy teams, and it could be like one and done. If they are appropriate for the treatment, they can get the help that they need, especially when psilocybin therapy requires a lot of prep and a lot of building trust within the treatment team. And so you can't wait until the last moment to do that. You need time for people to build an intention and build a goal and understand the treatment for them. So the wait times is a big one, and the medicine standardization for sure. And I feel as though that with psilocybin regulations enacted, at that point, the college doesn't have a choice but to create the scope for that to occur, which would be really nice to see. Just like medical marijuana, there's guidelines and policies for marijuana prescribing for physicians. There will then be that for psilocybin as well, and that will guide this work. Does Fraser or Alexis have anything that they'd like to add to this conversation that we haven't brought up yet? Anything on your mind about these topics that we've been discussing before we go into questions?
I just want to say I'm just so excited that we're actually having this conversation. Like I was, a few years ago, you try and project, when do you think this is actually going to happen, that we're going to be having these types of conversations? And it's just really, really inspiring, and really, it just makes me incredibly happy that this is happening right now for us.
Yeah, absolutely. And so thank you again to TheraPsil and to others that are doing this work. And yeah, I'm not going to take up any more time because there's some great questions that I can see there. So let's jump in.
Yeah, absolutely. Thank you for such a rich discussion, everyone, and for your time. We'll try to get to as many questions as possible, but if more come up as the discussion continues, feel free to pop them in the chat and we'll try to get to as many as possible. So one question was, I'm a death doula on the West Coast and have clients wanting MAID because my client is terminal with cancer and suffering debilitating cluster headaches. My client has been struggling with all the other medications to relieve their pain and medications to counteract their side effects at the first medications. It's been a nightmare. I would love to connect with any of the panelists to be able to better support my client. So does anyone have tips for this question?
Well, I would start off by letting you know that your patient could visit TheraPsil's website and go to the patient section and fill out the e-form there to be added to be contacted by us if they do meet our inclusion criteria. We have supported people with end-of-life diagnoses as well as cluster headaches. So I would encourage you to have them do that if they did feel as though it was something that would benefit them. I don't think that you've mentioned that they were interested in psilocybin therapy, so I'm not sure if that conversation is happening with that patient already or not, or if they're informed. It would be that they would have to be wanting to do the therapy themselves for them to pursue it. And so I'll let Alexis and Fraser comment further on that one.
Yeah, thanks, Natasha. Yeah, I would clarify, is the goal, to have the psilocybin with the goal of opening up the experience and having an improved outcome with the chronic pain. But I love the curiosity, because I do the work that I was doing in chronic pain really is tightly tied to all our experience from, prenatal, from before we were born right through our adult life. And it's really challenging to dig deep through the models that we have right now. But again, psychedelic has in a way of really opening our belief structures and opening our awareness to parts of ourselves that were simply unseeable to us before we explore. And with that new sight and new compassion and maybe new insight with a therapist, really interesting things can happen with pain.
Yeah, again, just a brief comment about pain. I mean, I think that we are too only beginning to learn about the mysteries of pain, and we have many other options now to treat pain. Some of them that sort of fall under sort of Western medicine, and others that don't. And I think we need to continue to explore things, because pain is complex, and there's probably not just one pill or something that's gonna be able to address it. So again, I think there are times where I've gone to conferences, 10-day conference on pain, and you feel like, oh, I'm going to know everything about pain. It's like, nope, there's still so much more that we're learning, which is exciting too, because we do know that there are many non-pharmacologic options as well that can be helpful.
Awesome. Thank you so much. Another question is, what does MAID, so we touched on the definition very briefly of medical assistance in dying therapy, refer to? I'm not familiar with that term in the US. So I'm wondering if Dr. Fraser and Dr. Alexis, you could just touch really briefly on what the actual process looks like for medical assistance in dying in Canada.
Want me to go ahead? Sure. So I know in Nova Scotia, and I'm not sure if it's different between the provinces, I'm actually not sure, but I know in Nova Scotia, there would be an application. So a physician or a nurse practitioner would apply to the MAID program. The MAID program then has physicians working for it that would meet with the patient, and they do a fairly robust, thorough intake about what were the desires. And
Sorry,
Yeah, that's okay. There used to be, I think, a 2-week window. I may be wrong with this, but I believe it was a 2-week window that you'd have to have a second interview, and that timeline has been shortened in some cases. And then essentially, the pharmacy prepares the medicine that is offered. A second physician is on board, and through IV access, the medicine is delivered to the patient in a very, very structured way, so that it is an absolute certainty that the patient would die based on the doses and the medicine being used.
Yeah, and maybe you'll just add in a few other points that may sort of answer some of the other questions that other people might have. So yeah, it varies a little bit province to province, but this is federal legislation, but how it's enacted is different. So again, in BC, someone makes their intention to be assessed for MAID, knowing that requires not a physician or not a nurse practitioner to be there, but to be witnessed by others to say, yes, they want that. And then once they've made that known, they have both a first and second assessment by a physician or a nurse practitioner to say that they meet the criteria. And usually it's the second assessor who then would set a date and time, or not, because some people will be assessed and say, I just want to keep this, as I made reference to, in my back pocket. And they might never proceed with it because maybe they're being able to access other things that are helpful. In comparison to the US, and again, I don't know the US, but I know, certainly in the US, there are many states that would have physician assisted suicide. So that was sort of something that was in the language for a while, and it's where physicians would prescribe sort of lethal doses, essentially, often of phenobarbital, that patients could fill or not the prescription, have it in their house, and then they would take it on their own. In Canada, medical assistance in dying is not that, although patients can take oral medications. So the patient has a choice to take oral medications or to have IV medications. In our experience, vast majority of people are choosing for the medications to be intravenously.
Thank you so much for those very thorough answers. Try to get to 1 or 2 more questions, just want to be mindful of time. What do you suggest patients with PTSD or MDD that are treatment resistant do to further advocate for access to psilocybin? I've asked my physician, and their response is that they are not allowed to support it, but cannot tell a patient not to try it. Leaves patients trying it on their own, which causes safety issues. Would making a formal complaint to the CMA help?
I think it's a really great question. And I'm so compassionate when I hear that. It's really a challenging space because of the legality right now around psilocybin and psychedelics, and the physician themselves. It's challenging for them to give advice to take a substance that's currently restricted. And there is the real safety issue. There's definitely some clients that, based on their history, if they're having active trauma or if they're not in a really safe, grounded container, it may actually not be the best decision for them to do that. They may actually have worse symptoms or a worse experience that's not supported. So maybe trying to align them with a clinician that hopefully in the near future is going to be able to do this work. Or maybe someone in the community that maybe is really well vetted and well experienced offering therapy, but they're often underground and also hard to access.
Yeah, I would just bring up the fact that TheraPsil is advocating for access to people for psilocybin with these other diagnoses, of course, if they meet the inclusion criteria and it's appropriate for them. And ways we're advocating for that is a lot of our ways we're communicating to Health Canada by submitting a couple exemptions for each diagnosis so that they're aware. But I would encourage you, if you are a patient and you did hope to get access to this in the future, maybe when regulations are created, to still go to our website and provide us your information so that we know that you're someone who has that diagnosis who would want access in the future. And if we are engaging in specific advocacy campaigns about maybe PTSD, you might then be on our mailing list to get information and know when access is available. As well as we've been letting people know, if you're really feeling strongly that psychedelic therapy is something that might help you, you might want to look into maybe ketamine therapy, because that is currently done legally in clinics by healthcare professionals where you have a safe container. And so looking into ketamine therapy could be an option for people with these diagnoses as well right now.
Awesome. Thank you so much. And we've got 1 minute left, so why don't we answer one more question? Do you think it's important to have a better understanding of this kind of medicine that all the physicians involved should try, or make specific training of psilocybin in different dosages? How could the path of treatment be different if we use psilocybin in contrast to using the whole mushroom?
Oh, that's a complex question. And
One to end with.
yeah, and I think that there's questions in there that we'll be thinking about for a while, and certainly, again, as we look at cannabis, there are different thoughts about trying to break it down into its constituents and put it into a pill versus using the whole product. And so again, I myself not sure that I know the answer to that, but I think we need to kind of look at that closely and see the benefits. We do have doses that we know that are being used under different protocols and things, but again, there may be some more dose finding that we'll be looking at, and certainly we haven't talked about microdosing and things like that at all today, but certainly that is the discussion. So that's not really an answer to the question, but I think we're going to be learning more. We're going to be learning more.
Yeah, I'm a big fan of nature usually gets it right. So I'm a fan of probably the whole product, just like the whole apple, the whole fish usually outperforms the constituents. But certainly with it's really interesting around microdosing and the perfection of dosing. It actually just may be more practical to have the chemical component isolated. And I think the part of the question was, do you think therapists or clinicians should also have a direct experience? Was that part of the question?
That's right. And I can answer that portion if you want. So based on TheraPsil's training program, in order to become a TheraPsil associate, you do need to have your own psilocybin journey where you guide and are guided through that experience. And so in our training, you get partnered up in dyads or triads, and you actually hold space. That's given that you get a Section 56 exemption in order to transport, consume, and possess psilocybin. And to date, 19 healthcare professionals who have been supported by TheraPsil have actually gotten their Section 56 exemption to have that experience. And it's absolutely crucial to have that experience in order to hold space for your patients. So right now, generally, the dose that we use in these sessions are 5 grams.
I just want to say before we end, thank you so much for the comments that you put into the chat. I've taken a copy there, and I'm going to go to those links and read this again more closely. It just such a wealth in the participants here today, and I learned things, and I'm going to learn by looking more closely at the chat comments too. So
thank you. Yeah, thank you everyone for being here. Thank you, Alexis. Thank you, Fraser. Thank you, Yaz. Thanks, Adam. I just feel so lucky that I get to do this and have these conversations and see how this movement is progressing and see all of the things that we're all learning about this. As every time I have these conversations, I learn so much and take so much away from it. And so thank you everyone for being here.